Behavior therapy versus cognitive behavioral therapy. Behavioral theories. Cognitive behavioral therapy and overall behavior therapy are both approaches to therapy that are connected but are never the same. The therapist's perspectives on factors that motivate the behavior set these two approaches apart. Therefore, these concepts explain human behavior or conduct and learning. CBT resembles and forms the basis of an overall talking treatment that modifies how a person thinks and acts to help them better deal with their issues. The most prevalent techniques are for treating depression and anxiety, but it also has potential applications for various other mental-based and physical-related health issues. Understanding how both therapies deal with human nature, the relationship between clients and therapists, therapeutic processes, and applications towards diverse groups is essential. View of human nature and personality. The counseling approach known as behavior-based therapy is rigorous and organized, founded on the concepts and techniques developed through the scientific process. This treatment style concentrates on the problems that the client or patient is now facing and seeks to identify and assist clients in changing any damaging or dangerous behaviors they may be engaging in collectively. Throughout behavior therapy, patients are strongly urged to participate actively in their treatments and take concrete actions to solve the issues they are experiencing. Although the root of the individual's psychological problem is still not understood, the behavioral approach maintains that positive changes can still occur throughout the client's existence. The foundation of CBT is that human emotions, ideas, and behaviors are all interconnected. Therefore, shifts in any of these factors can have ripple effects on other variables. Therefore, clients who participate in cognitive behavior-based therapy develop a greater awareness of the harmful thinking patterns and behaviors they engage in as a collective unit. Clients learn to recognize and control their ideas when treated properly under excellent therapies, in addition to the influence that concepts have upon their feelings as part of their treatment. Relationship between the therapist and client. Behavior therapy emphasizes cultivating relations and mindfulness practices, a greater capacity to tolerate suffering, improved cognitive emotion regulation capabilities, and so forth. The client works with their therapist to recognize and accept unhealthy thought patterns and identify and implement effective solutions. Maintaining equilibrium is essential when dealing with clients who struggle to acknowledge their problems and adjust their lives. The primary focus of cognitive behavioral-based therapy is the connection between an individual's emotions and thoughts. This therapy focuses on how ideas can impact feelings and why some patterns of conduct might cause mental health problems. CBT also emphasizes developing new behaviors and approaches to thinking to replace troublesome behaviors and assumptions. Counselors make regular use of CBT as an overall treatment for a wide variety of mental health-related issues, including but not limited to panic, depression, drug abuse, and many others. Cognitive behavioral therapy is a form of talk therapy that therapists use to assist clients when recognizing problems and challenges, determining what is triggering them, and developing new defense strategies, abilities, and strategies to assist them in overcoming these challenges. Therapeutic relationship and process. Similarly, as behaviorists are seen as proactive, cooperative, client-based, and upbeat companions to their patients in the behavior model, so are therapists who employ cognitive behavioral methods. Therefore, for counseling to be effective, therapists should be present for their clients during every stage of their lives, including the ups and downs. All therapists' primary goals with any client would be to assist them in observing things they internalized as erroneous notions and to encourage them to change their pessimistic worldview. Regarding cognitive behavior-based therapy, it is strongly recommended that therapists remain flexible within their approach and concepts to meet each client's needs. Lowering emotional problems and individual defeating behaviors are the primary goals of this therapeutic method. CBT aims to help people lead more authentic and compassionate lives. However, much like behavior therapy, the entire cognitive behavior technique centers on collaboration between therapists and clients or patients, with the latter taking the initiative to set specific, measurable goals. Collectively, the clients and therapists will determine what objectives are realistic and what are not. Application to diverse groups. Behavior therapy facilitates counselors from different cultural backgrounds because of the therapy's emphasis on the role of the client's surroundings and the challenges mentioned above. The holistic behavior therapy approach addresses clients' needs beyond individual problems or habits. Therefore, the technique uses a more holistic approach by looking at the overall client's environment to determine the root of the issues and assess whether a shift in attitude or behavior might lead to significant adjustments. Moreover, CBT has several benefits when used to treat patients from different ethnic backgrounds. Cognitive behavior therapists operate as instructors, guiding clients through developing coping strategies for their emotional-based illnesses. In addition, cognitive behavior therapists can help clients from a wide range of cultural backgrounds explore their ideas and build a more positive sense of identity by identifying their core tenets. Last, CBT shares the same foundational ideas and characteristics as behavior therapy. Therefore, cognitive behavioral therapy emphasizes internal psychological processes, whereas behavior therapy emphasizes external-based environmental influences.